The National Student Nurses Association Convention was held April 8th through 12th at the Gaylord Opryland Resort in Nashville, Tennessee. It was a convention full of excellent guest speakers, informative breakout sessions, a chance to speak with recruiters about interview techniques, time for networking with fellow nursing students from all over the United States, a chance to get certified through the American Red Cross for help in disaster sheltering, a mini NCLEX review, and many other opportunities for the nursing student. In this video, I'm going to give you a very brief rundown of what you missed, highlighting key points or things that I found to be useful from the discussions. The first session I will discuss is the mini NCLEX review. This was an 8-hour program spread over 3 days. A lot of it was review and reinforcement, which you can do on your own with any NCLEX review book, app, or review program. I felt the most important piece of information presented was about the test itself. The instructor did a wonderful job of explaining the process, but it was a 30 to 40 minute lecture. I will do my best to condense it. The test itself is 6 hours in length. No matter how many questions you get, you have 6 hours to take the exam. So don't rush. The test is graded on a linear continuum. Think of it as this gray box. The top half of the gray box is good. The bottom half of the gray box, not so good. Above the gray box is excellent, and we all hope to be here. Below the gray box, you want to avoid this at all costs. The difficulty of each question you are asked falls somewhere in this continuum, with simple questions being below the box, average questions falling somewhere in the middle of the box, and difficult questions falling above the box. Each question you answer correctly gets you a slightly harder question. Each question you answer incorrectly gets you a subsequent question of equal or lower difficulty. Are you confused yet? If, after answering your first 75 questions, you have answered the majority as correct, difficult questions, the test will end and you will have passed. On the other hand, if you answer a bunch of your first 75 questions incorrectly and don't achieve a 60% high difficulty question level in your first 75 questions, the test will end and you will fail. Most people, however, fall somewhere in the middle. The test can ask you up to 265 questions, and you can pass or fail at any point after 75 questions based on your difficulty level and the amount of right or wrong answers you give. Bottom line, take your time, think through each question, and do not change your answer. The test is not trying to trick you, it's just testing the knowledge you've already learned in your nursing program. Any questions? You can try the Pearson VUE website, or see me and I will attempt to give you a coherent, correct answer to your question. The Johnson & Johnson iDream Room was a very valuable resource for every nursing student. It offered many lectures on finding jobs, gave suggestions about interview wear, had a free headshot studio, and offered an assessment tool to see what type of nursing pathway might fit your personality, as well as many other valuable tips via pamphlet and career mentors on premises. You can take advantage of some of these resources by visiting discovernursing.com. There was entirely too much information given at the breakout sessions, ceremonies, and plenary sessions to try to fit it all in, but I'll hit the high points. Number 1. Trust your hunches. History is full of nurses who made a difference by following their hunches. They had visions of what might be, both on a local level and on a grand scale. They would not settle, and they were in pursuit of excellence. We should follow our hunches and be persistent doers, love our work, and make a difference. Number 2. The nurse is central to the delivery of patient care. We have to keep the patient at the center of this care. We need to advocate for the patient and speak up when things don't seem right. We are on a team with the doctors, surgeons, PTs, OTs, and other healthcare members. As a part of this team, we have a say in what happens and a responsibility to avoid medical errors because of a fear to speak up. Number 3. The current job market is not great, but there are still jobs out there. You need to be your best self and prepare for your job-seeking battle. Know yourself and what you want to do. Get the education you need to get the job you want. Become a member of professional groups that relate to what you want to do. Volunteer for anything in healthcare. Apply for any job related to healthcare. Stay in school. Never stop learning. Number 4. Forensic nurses deal with a lot of child sexual abuse. It was pretty depressing. Number 5. Find the study technique that works for you. There are tons of study guides, books, and websites out there. If it doesn't work for you, do something else. When taking a test, look for key words like ineffective, not usually, not applicable, inappropriate, least appropriate, and does not occur. Most students will gloss over these words, read the question wrong, and then get the answer wrong. Look for similarities in your options. If 3 answers are similar and 1 is different, that different answer is usually the correct answer. Remember your order of importance: oxygen, fluids, nutrition, elimination, and rest. Number 6. Nursing informatics is very confusing and very lucrative. The average informatic nurse makes $90,000 a year. Nursing informatics does not always deal in the high-tech realm. They do everything from a DIKW pathway, where D equals raw data, I equals information, K equals knowledge, and W equals wisdom. They collect data, interpret, and teach. They support clinical practice by making it more efficient, and they also help with saving money and aiding in the ease of decision-making. Number 7. Perioperative nurses deal with pre, intra, and post-surgical patients. It is a highly collaborative field. It requires great prioritization and anticipation. Most perioperative nurses must live within 30 minutes of the hospital because they will have a 30-minute call time for surgeries. 60% of perioperative nurses leave in the first 6 months of work because of some sort of lateral violence or bullying. That's 1 in 3 grads. Know your chain of command and don't tolerate the bullies. Areas you can work in with perioperative nursing are ambulatory or outpatient surgery, hospital-based surgery, pre-op, and PACU. For more information, you can visit aorn.org. Number 8. The portfolio is the new resume. It should contain observations, clinical experience, conferences attended, contact hours, written papers, letters of recommendation, and your actual resume.